Namaskar, Dr. Atmaram Pawar. Welcome to NEP Parayan, the series based on my understanding and your suggestions regarding effective implementation of NEP. And today I'm delivering the 15th Adhyay of this NEP Parayana, which is started on 10th May 2024. I'm very happy for your response and what I understood and what I suggested. I presented you over this last 49 episodes, and today I'm presenting the 15th episode. So, from last episode, we are looking for some improvement in a particular subject. So, subject taken by me is the general pharmacy from the pharmaceutics. And last time we seen the theoretical part, and today practical aspect of this general pharmacy. I'm taking this as an example. So general pharmacy practical syllabus, what is in the proposed syllabus, it mentions about the pharmaceutical calculations at the first chapter and the list of different dosage form for compounding purpose. It includes solution chapter that includes the strong solution of ammonium acetate, the cresol soap solution, Lugol solution, syrups, linctures like a terpene hydrate linctures, elixir like a paracetamol pediatric elixir, throat pain, suspensions, emulsions, powders, granules, suppositories, then the semi-solids like non-staining iodine ointment with methyl salicylate, gargles like iodine gargles. So all this part is compounding, and over many years we are teaching the same thing, and students are doing the same practice of compounding of this traditional medicament or the preparations. So, what is my observation regarding the practical portion of a general pharmacy? So, this course content is more related to the compounding of dosage forms, the compounding practice, as well as most of the formulations listed here in the proposed syllabus. They are either outdated or not have a relevance in the recent days. Definitely, we can think that students should know the art of compounding and traditional practice. But considering this old is gold, we have to adopt, implement many new things also. So there should be a balance between the advanced technology, advanced practices, current scenario, and many things we have to learn, many more. So we should not repeat the things. And we should not take very old preparations which are not having the any relevance, and it should be realistic that students should feel it is a realistic syllabus they are studying. So what are improvement in the practical portion I'm suggesting? The first, it should be realistic and useful. Secondly, there should be a proper flow. That is, in the first year, students are learning what is the dosage form, how the dosage form is formulated, and then how it is dispensed, what is the prescription, likewise, so that we can get a connect up to the higher classes. So then the physical pharmaceutics, which gives the theoretical aspect of the formulation design, stability, correct, and then the formulation, manufacturing, quality control, all these aspects in the higher classes, that is the dosage form design subject what is the proposed. Another point is the pharmaceutical calculation, as the first chapter is related to the pharmaceutical calculations. But if we separate all the calculations, then student not feel there is a connect. So during taking a particular dosage form, we should teach them regarding the calculation part, whether it is a percentage calculation or geometrical dilution or the dose calculations. So it can be considered during the teaching of the particular dosage form, during the formulation of particular dosage form. So in a summary, I insist on shifting our focus from compounding of traditional medicament to the dispensing of the modern medicament. Instead of having outdated formulations, so we should have the current formulations which are there in the market. So we'll take some examples from the syllabus. The first example is the non-staining iodine ointment with methyl salicylate BPC. So what Google says? What Google says that this preparation, the old preparation which is based on the reaction between iodine and RHS oil, is stopped primarily due to the stability issues, inconsistent efficacy, development of superior or not irritating alternatives. So what is mentioned is that this reaction is not a guarantee that the complete reaction will take place. Secondly, this product, whether it is non-irritant or not, the proper efficacy data is not there. We can say that iodine irritation will be minimized. Again, there is a problem of a safety. And lastly, staining. Though such a products also stain, and therefore, due to all these reasons, that original company GSK also modify that iodex formula. Now their iodex formula contains different oils. hmm, And they prepared the pain analgesic formula, including turpentine oil, nilgiri oil, eucalyptus oil. Different oils they are using. So they are not going as per the BPC formula, that is non-staining iodine ointment with methyl salicylate. But in 2024, when council is proposing a new syllabus, it have this non-staining iodine ointment with methyl salicylate. So we should concentrate on that. There are many analgesic preparations like this or any other can be prepared using different methyl salicylate definitely can be used, and different other oils can be used, and Vicks balm, Zendu balm, like preparations we can prepare in the first year also, and student will feel like in house also I'm using this product and I'm preparing in the laboratory. Really, it is a realistic and practical going experiments he will do. So these all concepts I explained in my book. So there's a, for example, modern dispensing pharmacy, the first of its type of book I released or published in 2004, and that mentions that this iodine formula, iodic formula, the preparation was used as a counter irritant, but recently this claim is not rational. I mentioned it, though since it is in the syllabus, I also included in my book, but I have that note part, and all these my books, current books on the pharmaceutics for B Pharm or pharmaceutics for PharmD, all these books have that note, underline note, that this preparation is outdated and we are just studying it as a art of compounding, nothing more than that. So strong solution of ammonium acetate. Definitely the strong solution for ammonium acetate is IP formula. It was used as a diaphoretic in the traditional days, older days. But nowadays we have to check which are the different diaphoretics practiced by doctor, practice in the market. And here, this is the reaction between the strong ammonium solution and the glacial acetic acid. Both are very difficult to handle. And what we get, that strong solution of ammonium acetate, nowadays it is used as a chemical for different reasons, but it is not used as a diphoric preparation. But again, this proposed syllabus contains this strong solution of ammonium acetate. I also included in my books, but here I mentioned that however this product is not used in modern days. So this is more important, and this is more important to delete that. Terpene hydrate linctus. Again, it is the IP formula, old IP. It contains for expectorant purpose. But what is the current scenario? That product is not available in the market. So no longer it is available in India as well as in the US. It is due to the lack of data. Sorry, it is a lack of data on the safety and effectiveness of that product. But this terpene hydrate is one of the ingredient available in the marketed products. So these are the names I given. Means one can shift to the simple expectorant preparation. Definitely, there is no problem. We should go for a expectorant preparation, but using the current scenario, current medicament, current API, and current formulations which are there in the market. The compound syrup of ferrous phosphate, which is hematinic purpose, which is used to increase our hemoglobin iron formula. It is, see the reaction, number of reactions, one, two, three, four, five. So 4, 5 reactions are there to get that product. Again, it is very fantastic to do the reactions as the art of compounding, but this product is no more used, or it is not possible at all to use due to this number of reactions. So conveniently we are getting here ferrous sulfate, ferrous gluconate, ferrous fumarate, all these APIs are available, and all such preparations are available in the market. The product is in the demand, so demanding product is there. But if we teach the student like such a product requires this much reactions, and we are not again quantifying the reaction is completed or not, or whether there is a the residue of that original molecule is there. So likewise, so such complications we should avoid in this 21st century era, and we should teach them what is the modern. Paracetamol pediatric elixir, very widely used product, but it is not elixir at all. So elixir is not available due to its content of alcoholic solvents. So therefore, in the market, syrup is available. In the market, suspension is available. And if it contains any alcohol, then there is mention that this preparation contains the alcohol and it is injurious to liver. Likewise, so therefore, all the companies are preparing the suspension, pediatric suspension or pediatric drops in the form of syrup, and here we are proposing the pediatric elixir. Again, in my books, I mentioned that however nowadays the alcohol containing liquids are not recommended for pediatric use. So we should also go for the what is available in the market. So student will learn, definitely they will take the product from market also, or they can give the example of the marketed products, and they will feel like okay, in the laboratory I'm preparing this paracetamol. So iodine gargle, it is very, very old formula, very simple formula. It is iodine, potassium iodide, glycerin formula. But what is mentioned is the historical pharmaceutical reference. That is, it is not even given in the regular BPCs. So BPC contains Mandel pens, BPC 1968. So my first point is this is a very old formula. It is not available in the market. Even it is not available in the regular, the current pharmacopoeias. I have doubt that how many these colleges, pharmacy colleges have at least BPC 1968. I forget about the older edition. And then again we are proposing here the iodine gargle. So some will write something without referring the official book. Then the student will prepare that. But if we see the current scenario, there is the iodine povidone solution there in the market. We can prepare it. It is very fantastic. So likewise, my suggestion is that, so can we shift general pharmacy concept to the modern dispensing pharmacy concept? Can we replace compounding of traditional preparations with the prescription handling, the dosage forms, con- concept of formulation, and using the modern formulations which are available in the market? Definitely, we should teach them compounding of dosage forms, 5, 6 examples of starting from syrup, some medicated syrup, then some products which are available in the market, including ORS powder, which is in the powder. Some granules are there, laxative granules are there. Then in the case of ointments, we can take a sulfur ointment which is available there, or prepare methyl salicylate, or prepare pin balm like a preparations. So which are available in the market, they can be prepared. So whether it is official or unofficial, but it should be realistic. So first, definitely we should teach them compounding, and in the higher classes, which will teach them the large scale manufacturing. Compounding and large scale manufacturing collectively will give the idea to the students, so how the lab scale manufacturing is done and how the industrial scale manufacturing is done. So this is the point definitely we should cover, but the preparation should be realistic and from the market. Therefore, what I suggest is compounding 5, 6 preparations, but dispensing more formulations. So dispensing of 5 OTC marketed products. So we have analgesics, we have antipyretics, we have the expectorants, we have the antiseptics, laxatives. So likewise, many products are there. So the students can bring the product from market or from their house if they are using, and ask them to dispense, ask them to understand the concept, what it is, correct? So for example, if we take the Disprin, then when not to take the Disprin, how it causes the ulceration, how it may lead to the blood thinning, so when to use, when not to use. Likewise, if we use the expectorant, really the formula is the expectorant formula, or it contains some steroids, it contains some anti-allergic agents, whether it is a OTC formula or whether it is a prescription formula. Likewise, and really the student will be happy because they are routinely using, their parents are routinely using that medicament, that we have to teach in the first year. So they will feel like, okay, they are entered into the pharmacy, not that older pharmacy, that newer pharmacy. Then the dispensing of prefabricated preparations. So instead of compounding all 25 preparations, I'm suggesting here dispense that prefabricated preparations. Ask the students to bring, or the college to make, should make a stock, correct, of the some preparations. So if it is the prescription medicament, get it on sample, and mention that it is for the educational use, and give these preparations to the student and ask them to dispense. Hmm? So take some prescription, either typical prescription you can design, your teacher can design, or take a prescription from market, directly. So if it is a real prescription, then one point you have to maintain confidentiality about the that patient and doctor. Otherwise, you can take that prescriptions and dispense these prefabricated products. Again, that prescription where student will learn evaluation of prescription, making patient medication record, dispensing label, billing, patient instruction. So likewise, all the concept what is ideally we are explaining, they will do in the, and they will write in the journal. They will mention the patient medication record. They will mention the refill of the prescription. Then the dispensing label if they are preparing. All it is a possible by using the this concept. So I promote here the modern dispensing pharmacy instead of compounding of traditional, outdated, non-realistic the formulations. So therefore, the general pharmacy should become the modern dispensing pharmacy, where we should replace compounding with the dispensing, the traditional preparations with the marketly available or market relevant preparations, outdated practice with the recent practice, and instead of writing a name general pharmacy, make it modern dispensing pharmacy. So it is my first book, which is came as a in the syllabus of many universities, and then many authors in India even publish their books on the same name, Modern Dispensing Pharmacy. This is the original concept. I'm not promoting myself, but I'm promoting what is really required for India to learn newer things. So that I'm proposing, and this is the my efforts from 10th May 2024 on the NEP Parayana, where I written some articles in professional articles in the English, as well as in a Pune. I written two articles in a reputed newspaper like Sakar, Maharashtra Times. So I have the 50 videos, 32 leads, Marathi articles, journal articles, and public talks. And I'm very happy due to your support. What support you are giving, I really happy for that. Many of you are watching. I am very happy for that. And today also I am present here few feedbacks. So first feedback is from Shantanu Kale from Nasik. What he says, NEP बद्दल अत्यंत कळकळीने इतके पॉझिटिव्ह राहून NEPचा अभ्यास करून तुमच्या डेली रुटीन मध्ये बाहेर पडून तुमचा कम्फर्ट झोन ओलांडून YouTube वर तुम्ही एवढे एपिसोड जाहीर करता. धन्यवाद Shantanu. It is my energy that you are appreciating me, motivating me, and I'm really thankful to the Bari sir from Shirpur. It is a great work you are doing for the profession. I'm proud of you. People like only you can uplift the pharma profession. Thank you, sir. I'm doing my share for the pharmacy profession. Anil Pete from Nagpur says the thank for sharing the videos. You have nicely explained NEP in the layman's language. So many episodes are taken in Hindi so that any common man can should understand what is the NEP. So therefore, I'm very happy and thankful and also emotional for this publishing the 15th episode of NEP Parayana. And I really very thankful for very few members. So the pharmacy profession is very big, but if we see that the feedback and the people watching, they are not in big number, because many times it is not required to understand each and everything, but very few people who are responding, who are listening, who are understanding, who are suggesting. I'm thankful to them, and they made me to create next episode, and we'll try again. If I get a chance, I will continue. Thank you for that time. Thank you once again.